A very good morning to you in the US, and a good afternoon to those who are in the long way. I'm delighted that we are now finally ready to sign this memorandum of understanding. But before we go, allow me, please, to introduce again myself and the team members who are present for this ceremony. So Ambassador David, who is the head of mission for SARO. Also attending is Miss Miranda Lutempo, who is a senior policy officer, and Miss Agido Adwok Niaba, who is our communications officer, and Miss Marjorie Tausi, who is the secretary at the office. And like Miranda has said, actually, as we speak, Mr. Evansy is traveling for a mission in Uganda. Thank you very much.
Well, and thank you, your Ambassador, Your Excellency. We are so pleased to be here with you. And if it is all right with you, I will take a few moments to introduce our team.
Thank you very much. Please.
With us today, and I am Kylie Dotson-Blake, President and CEO of NBCC and Affiliates, and so pleased to see you and all of your team again, and have appreciated the wonderful conversations and planning that we've had over the time together. And we have also with us the chair of the NBCC Board of Directors, Dr. Mona Lisa McGee Barada. Yes, and we have the chair of the NBCC Foundation Board of Trustees, Dr. Rhonda Bryant. Right. We have our COO, Ms. Rebecca Ambram, and our Vice President of the Foundation and Professional Services Division, Ms. Isabel Gomez. And we have Dr. Wendy Schweiger-Moore, who is serving as the moderator for this wonderful time together, and also serves as the Director of Global Capacity Development, and Ms. Eugenie Yang, who works closely with Wendy and coordinates all of the MHF programs across the African Southern region and COMESA and in other parts of the world as well. So we are so pleased to be here with you today.
The pleasure is certainly ours. Thank you very much.
Thank you, Your Excellency. Ambassador David Claude Pierre and Dr. Kylie Dotson-Blake, President and CEO of NBCC and Affiliates, staff and leadership of NBCC and Affiliates, and leadership of SARO. I'm very pleased to serve as the moderator on this important occasion to once again formalize the relationship between SARO and NBCC through the virtual signing of the 2022 MOU to develop a working arrangement on mental health programs. I would now like to introduce Dr. Dotson-Blake to begin our ceremony today with some introductions. Dr. Kylie Dotson-Blake serves as the President and Chief Executive Officer for the National Board for Certified Counselors and Affiliates. With over 71,000 national certified counselors and partnerships and engagement in more than 40 countries, NBCC strives to leverage the power of counselor certification to advance health equity and expand access to mental health services across the globe. NBCC works with its affiliates in these efforts, the Center for Credentialing and Education and the NBCC Foundation. Dr. Dotson-Blake joined the leadership team at NBCC as the interim Chief Operating and Policy Officer and later served as the interim President and CEO. Her tenure at NBCC also includes 6 years of service on the NBCC Board of Directors with 2 terms as the elected chair of the board. Dr. Dotson-Blake previously served as professor and counselor education program coordinator at East Carolina University in Greenville, North Carolina. She holds a doctorate in counselor education from the College of William and Mary. Over the course of her career, Dr. Dotson-Blake's scholarship and engagement has focused on increasing access to mental health services in rural communities and expanding counseling services for children and families. Her professional service has largely centered on promoting and sustaining the professional infrastructure of counseling through governmental engagement and interagency collaboration. Through her work with NBCC and Affiliates, she has collaborated with international partners from Romania, Argentina, Bhutan, Malawi, Mexico, and others to advance legislative recognition of the profession of counseling and expand access to mental health and career development services. Dr. Dotson-Blake.
Thank you, Dr. Schweigermore. And Your Excellency, we recognize how precious your time is, and we appreciate the opportunity to be here together with you. We have a few brief remarks that we'd like to share, but we will keep those as very brief as possible. And so we want to start with a bit of history about the journey that's really brought us to this work together. For more than a decade, we at NBCC have had the pleasure of partnering with organizations and governmental entities in Malawi and other countries across the southern region of the African Union and COMESA. These partnerships have resulted in impactful community-based mental health education and service provision programs. And in 2013, we moved forward together with the Office of the SARO Regional Delegate to plan a collaboration that was intended to expand mental health education and services in the region. From this collaboration resulted a conference that was planned and facilitated by AU-SARO and NBCC in 2019. And I hold much gratitude. I know that he is out doing good work on his mission today, but Mr. Evans did a wonderful job and with the fantastic planning of the event and ensuring that there were a broad spectrum of partners engaged at the event. This collaborative event, the Conference on the Improvement of Mental Health Services in SADC and the COMESA regions, was a convening of representatives from universities and ministries in Botswana, Malawi, Mauritius, Mozambique, Namibia, South Africa, COMESA, the World Health Organization, the United Nations Development Plan, UNICEF, and the Guidance, Counseling, and Youth Development Center for Africa. Quite a number of partners were engaged at the conference, and the conference enabled participants to learn a great deal about the existing mental health services across the southern region and the need for increased mental health services. The wisdom, expertise, and insights from professionals working on the front lines in their communities, cities, and countries provided invaluable opportunities for learning for the participants and engagement together, ways we might do things differently and better. Your Excellency, Ambassador Pierre, you have led a life of service, and your investment in youth and their development has transformed the communities you have touched and those who have learned lessons that you have shared through your writing, through your teaching, through your presentations, your leadership, and your own direct in the community engagement. We are honored to have the opportunity to collaborate with you and your team to expand mental health services and education through the Mental Health Facilitators Program. The MHF program has been developed through intense engagement with communities across the globe. The program reflects the lessons learned through this engagement, and the impact of the program is foundationally linked to the integration of cultural responsiveness into each delivery of the program. Put simply, the experiences, culture, context, and needs of the community served are identified and responded to through a partnership-based program development. This work only works when we work together. And we appreciate and step fully into the engagement with your team. In a 2016 research study that was conducted by an external researcher, Dr. Melissa Luke, participants from school-based mental health facilitator training programs in Malawi cited multiple positive outcomes from their participation and from the implementation of the program itself. These participants all highlighted the program's emphasis on interconnectedness and the positive alignment of that with their culture. They cited the program's effect on creating a community of helpers and providing a platform for a shared language and common desire to support students, families, and communities. We hope that the MHF program will continue to offer positive, meaningful support to communities across the southern region and COMESA. We deeply admire Ambassador Pierre's commitment and passion, and that of his staff, for the welfare of the African people, especially the youth of Africa. We appreciate the direction and leadership that your team has provided to our team at NBCC. We are so excited, so deeply excited to move forward together in this incredible journey to expand access to mental health services through the MHF program. We thank you for your partnership, Your Excellency.
Thank you. Thank you very much.
Thank you. I would now like to introduce His Excellency, Ambassador David Claude Pierre. Ambassador David Claude Pierre is a career diplomat with over 20 years of experience in academia and development of policy, international relations, negotiation, and mediation. He has had an array of experiences in politics, African policy design, and governance. Ambassador David has served as ambassador of the Republic of the Seychelles in Sri Lanka, the Democratic Republic of Ethiopia, and as well as a non-resident ambassador to the Arab Republic of Egypt and the Republic of Kenya. His other areas of involvement are serving as a member of parliament, leader of the opposition, member of the Pan-African Parliament, and serving on several platforms as treasurer and chairperson, positions of great trust and honor. Currently, he is the permanent representative to the African Union, SADC and COMESA, at the African Union Southern African Regional Office in Malawi. Ambassador David speaks 3 languages, Creole, English, and French, and holds a Bachelor of Applied Science from the University of Perth in Western Australia. Your Excellency.
Thank you. Thank you very much. Indeed, we are, like I said earlier, we are so delighted to have been able to build this kind of partnership and relationship with the NBCC. So what I've done is I would like, as I begin, to respect the protocol and begin by saying the chairperson of the NBCC Board of Directors, Dr. Mona Lisa McGee, the chairperson of NBCC Foundation Board of Directors, Dr. Rhonda Bryant, the president and CEO of NBCC and affiliates, Dr. Kylie Dotson-Blake, the chief operating officer of NBCC and affiliates, Ms. Rebecca Umburn, the vice president of the Foundation and Professional Services Division, Ms. Isabel Gomez, Dr. Wendy Schreiger-Moore, Director of Global Capacity Building, staff and colleagues at the African Union Southern Africa Regional Office, a very good morning and good afternoon again to you all. Now, allow me to take this opportunity to welcome you all to this very important session. As you are already aware, the aim of our session today is to sign the MOU between our 2 parties designed to cement further the partnership between the African Union Southern Africa Regional Office, the SARO, and the National Board for Certified Counselors, NBCC. Now, this is definitely a cause for celebration because the signing of this Memorandum of Understanding will also facilitate, broaden, and improve the level of cooperation and collaboration between the 2 parties and allow us to establish working arrangements necessary to ensure effective cooperation in areas of mutual interest. One of the areas which will serve the purpose or objective of this MOU is our strong collaboration on the implementation of mental health, guidance, and counseling training in Africa. Now, for this important day to arrive, there have been a lot of background work by the SARO and NBCC. In this regard, on behalf of the SARO and on my own behalf, I would like to extend our most sincere gratitude to NBCC for your support and continued collaborations, and indeed for also facilitating the preparations of this very important event. I should say that you all deserve a very big round of applause. Excellent, ladies and gentlemen. Now, the mandate of SARO is to coordinate the implementation of African Union programs within the Southern Africa region, as well as develop and maintain constructive and productive relationships between the AU and member states within the region. Consistent with the AU core areas of activities and the mandate of our office, the SARO has been implementing a number of programs on the youth through the African Union Youth Charter, and we have also been following up on a number of public health initiatives, such as the COVID-19 pandemic, through the African Union Center for Disease and Control for Southern Africa. However, The added bonus of this new partnership is that it will allow the AU-SARO to develop areas of collaboration towards the expansion of services in guidance and counseling that address Article 24 of the Youth Charter, which entered of the Africa Youth Charter, which entered into force in 2009, and which talks about the expansion of mental health and counselor training and services in Africa. In addition, the Africa Youth Charter stipulates that Africa's greatest resource is its youthful population, and that through the active and full participation, our continent will be able to surmount the difficulties and challenges that lie ahead. The regional office also takes note that youth are marginalized through inequalities in income, wealth, unemployment, and power, which lead to other excessive pressures. Therefore, the office finds it relevant to promote young people's active participation in all spheres of society without discrimination and access to their fundamental rights. This can be made possible with the right mentorship and training of the youth, which NBCC is proposing to support. Furthermore, Article 16 of the Youth Charter talks about mental health as an essential component in youth development, where young people shall have the right to enjoy the best attainable state of physical, mental, and spiritual health. All in all, therefore, this partnership will build on the already existing initiatives on youth mentorship and counseling within the region, which will help offset some of the socio-economic challenges that the youth are facing on the continent. As I end, I am hopeful that this partnership will build synergies on more effective engagements on mental health, while also expanding those engagements to greater avenues. For this, I thank the NBCC for the support. I also would like to thank the office for everything, for all the effort that they have put into ensuring that this day arrives and this MOU is finally signed. Thank you very much.
Thank you. Thank you so much, Your Excellency. We appreciate those important remarks, particularly the element of how critical it is that we address all aspects of career, economic opportunities, the health, the education of the youth. That is absolutely essential. And Dr. McGee-Barada, who will be speaking next, she has focused on that work, those areas of focus herself over the course of her career. And for over 20 years, she has practiced, taught, and provided administration for multi-state behavioral health programs. Dr. McGee-Barada currently serves as the program chair of the Clinical Mental Health Counseling online program for the College of Social and Behavioral Sciences of the University of Phoenix. Dr. McGee-Barada previously served as the Divisional Social Services Director for the Salvation Army Western Division. She has supervised clinical programs, human resource functions, and finance operations for social behavioral health services in 3 states in ways that truly transformed communities in those states. Through advocacy, scholarship, and legislative initiatives, Dr. McGee-Barada has advocated for human services and supported the implementation earmarks, including the United States Senate Health Education, Labor, and Pension Committee's Iowa Community Integration Project. Her research was cited in President Obama's MLTSS report, and Dr. McGee-Barada's personal investment in advocacy has grown from a deep commitment to service that was instilled in her from her youth as the daughter of John McGee, Peace Corps administrator and founder of Gentle Teaching. From her early childhood experiences in Brazil and her later service with the Salvation Army, Dr. McGee-Barada respects the transformative power of community. She has worked with governmental agencies to advance public awareness of human trafficking and to expand funding to support a robust continuum of care and vocational rehabilitation. Additionally, she has served on the board of NBCC's affiliate, the Center for Credentialing and Education, CCE, including a term as chair in 2016-17. Dr. McGee-Barata graduated with honors from Creighton University and was awarded Outstanding Minority Graduate Student by Creighton Black faculty and administrators. Thank you for being with us, Dr. McGee.
Thank you so much, Kylie. And what a joy today is. It's about joy in partnerships, and Your Excellence, Ambassador Pierre, the AU SARO staff, and NBCC and affiliate board members and staff, thank you. Thank you for your partnership, for your hands in joining together. NBCC was founded in 1982 as a credentialing body for professional counselors. Over the years, we've come to realize the transformative power of professional certification and have focused our efforts on promoting global health through counselor certification. As Kylie shared, as a child of the Peace Corps, I saw the transformative power of community. And that's really at the heart of what Kylie, the team, Your Excellence, all of your efforts. Thus, it's fitting that this partnership will greatly expand the mental health facilitator, thanks to His Excellency and the AU SARO's belief in program and NBCC's ability to be a worthy collaborator in this MOU. This will be based in Lilongwe. This MOU in partnership with AU SARO is the kind of engagement that the NBCC Board of Directors is proud to support. And we know that the MHF program will be guided towards great success by following Your Excellency's leadership and that of your team. I further understand, Your Excellency, that the MHF Africa pilot program will include the country that you are from, the Seychelles. And forgive my pronunciation, I'm not very good sometimes at that. Let me say that we are excited to collaborate with you, and that NBCC has not previously had a collaboration there. So this relationship will bring us not only a deeper level of engagement towards enhancing mental health in the AU SARO member countries, and then hopefully in Africa, for trusting us to work with communities near and dear to your hearts. And we are excited to further collaborate with Malawi and Zambia with the MHF pilot. As discussed between the AU SARO and NBCC teams, after the pilot phase of this partnership, NBCC staff will seek our additional grant funds to support program expansion towards advancing the United Nations SDG Goal 17 in support of global partnership for sustainable development. In the meantime, NBCC's Board of Directors has committed to providing funding to support the pilot phase as discussed between the two teams. Again, what a joy. We are humbled to have the opportunity to work with you and your team, Your Excellence. Thank you for this opportunity.
Thank you.
Thank you, Dr. McGee-Barata. And Your Excellency, Ambassador Pierre, you spoke so eloquently in your time about the importance of connecting government and the people, and that government serve the people, and that we ensure that policies are in place that will support programs that serve the people. Dr. Rhonda Bryant and Dr. McGee-Barata are both leaders who have led in that direction over the course of their careers. And Dr. Bryant she has been right at the interface of that work in terms of helping universities and governments work together and provide services to the students who are most vulnerable. She's done that work in many ways, and I'd like to introduce Dr. Bryant now. As an active member of the counseling profession, Dr. Bryant has held leadership roles in diverse counseling organizations and in community settings since obtaining her PhD from the University of Virginia in 2000. With expertise in mental health, substance abuse, and counseling in educational settings, she holds credentials including the NCC, the CCMHC, the NCSC, and diplomat status with the American Mental Health Counseling Association and trauma and substance abuse counseling. Dr. Bryant is committed to eliminating mental health disparities and takes every opportunity to educate the public about the value of professional counseling. As Assistant Vice President for Student Success and Retention at Radford University in Virginia, she strives to ensure that students have access to mental health and support services necessary for college success. Dr. Bryant formerly served as the Associate Vice President of Student Life and the Dean of Students at the University of the Pacific. For the Stockton, San Francisco, and Sacramento campuses. She led 7 units, including assessment, conduct and community standards, intercultural student success, Latino outreach, new student and family programs, residential life and housing, and university dining experience, and also student success coaching. Her commitment to transforming higher education to better meet the needs of the diverse student communities we serve is visible in her daily engagement with students and leaders on her campus and in other professional partnerships. Her units have provided services to more than 6,000 students. And she's worked on policy with professional organizations and associations with through governmental grant engagement. She is a person who lives and leads through her service and commitment to students and communities that's quite reflective of the experiences that the ambassador shared. Dr. Bryant.
Thank you so much, Dr. Dotson-Blake. Your Excellency, Ambassador Pierre, AU, SARO staff, and NBCC and affiliates, board members and staff. What a wonderful day, hands around the world. This is an auspicious occasion. As the chair of the Board of Trustees for the NBCC Foundation, in cooperation with the NBCC Board of Directors, I lead the other trustees as we work to provide policy and guidance to the Foundation and Professional Services Division staff led so ably by Ms. Isabel Gomez. Part of the mission of the NBCC Foundation is to leverage the power of counseling by strategically focusing resources for positive change in order to improve the mental health of the underserved and never served throughout the world. One of our priority objectives is to expand community capacity through education and resources offered through the Mental Health Facilitator Program. In support of the African Union's Agenda 2063 priority areas, NBCC and the NBCC Foundation are pleased to provide the majority of funding to support the articulated trainings in Africa with the intention of building mental health capacity towards providing development assistance. The Foundation is also aware of Your Excellency's special interest in the welfare, including the mental health wellness of youth, and are proud to support those efforts in support of Article 24 of the African Youth Charter on the rights and welfare of the child, which addresses mentally and physically challenged youth and emphasizes measures to encourage regular attendance at schools, reduce dropout rates, and to take measures in respect to gifted and disadvantaged children, so that all children have access to education. As you know, competent guidance services in schools can help achieve this. Therefore, Your Excellency, you can imagine the excitement of the Foundation trustees when we realized that this partnership was going to move forward through this MOU. I would like to reiterate what Dr. McGee stated on behalf of the NBCC board and say that for the Foundation board, this type of partnership is very important to the board trustees and has the capacity to allow the Foundation to meet this mission with citizens and youth in the AU, SARO regions, and hopefully working towards this mission in Greater Africa. Thank you.
We are so appreciative of the work of Dr. Bryant and Dr. McGee Barada and Your Excellency, the Ambassador, as leaders of initiatives such as this that will come forth from this partnership and initiatives such as this in all of your professional lives. We are humbled by the opportunity to be the hands and the implementation workers, with you, but also for you. And we appreciate your trust in us and our ability to provide these services and the opportunity to move forward together like this. Thank you. Thank all three of you. And thank you so much, Your Excellency, for entrusting NBCC and the NBCC Foundation to be in partnership with you in this manner.
Thank you very much.
Your Excellency, Ambassador Pierre and Dr. Dotson-Blake, we now invite you to formally establish this relationship through the MOU. Would you please each sign the MOU in your locations? I think that calls for a round of applause, everyone. Your Excellency, Ambassador Pierre, Dr. McGee-Barata, Dr. Bryant, Dr. Dotson-Blake, AU SARO staff, and fellow NBCC and affiliate staff. Today is truly a remarkable day for the board members and leadership of NBCC and affiliates, and for the staff of the Global Capacity Building Department. As Dr. Dotson-Blake said, the joint conference in Blantyre inspired NBCC to consider how we could most effectively collaborate to increase culturally appropriate mental health services in Africa. His Excellency Ambassador Pierre reminded us that one of the main objectives of the AU SARO office is to implement and oversee programs in AU SARO with AU SARO member states, and that the importance of the strong collaboration between NBCC and AU SARO towards mental health, increasing mental health services and guidance and counseling training in Africa. He reminded us that this new partnership allows expansion of guidance and counseling mental health training as per the African Youth Charter, especially towards youth, Article 24. His Excellency emphasized the need for this partnership to serve youth and in AU SARO member regions, and then we hope eventually in the greater African continent, in order to strengthen physical, mental, and spiritual health for youth. Dr. McGee-Barata explained how partnerships such as this meet the expanded scope of NBCC towards enhancing mental health care worldwide. And Dr. Bryant discussed the priority of the MHF program amongst the programs offered and supported by NBCC and the NBCC Foundation. Your Excellency, I am personally extremely excited to begin this partnership, and I'm looking very forward to working with your team to travel to Lilongwe very, very soon, either later this month or perhaps early next month, so we can begin the planning stages in this journey, we hope, long journey together. With that, I want to thank everyone, Your Excellency, members of your staff, and the members of NBCC's board leadership and staff who participated today. And we look forward to working with AU SARO, NBCC leadership, and other NBCC staff over the next 4 years towards program implementation. Thank you very much.
Thank you. Thank you very much. And indeed, we are also delighted and we look forward to the next chapter in this relationship between AU SARO and NBCC.
Thank you, Your Excellency. And with your permission, I will go ahead and close this ceremony.
Indeed.
Thank you, everyone. Have a good rest of the day and a good evening.
Thank you.